Hi everyone, welcome back to my channel H&E Life. And in today's video, I want to do something a little special. I had a little get-together with some of my old co-residents from University of Chicago, and I guess they're now colleagues. Two of them are already blood bank attendings, and one will be becoming a blood bank attending soon in the next academic year. And because I had so many blood bank people together in one room, I asked them if they will do a nice little interview and share their thoughts about blood bank and transfusion medicine. So let's not hear me ramble anymore. Let's get started with the interview.
Okay, I guess I'll start since I just decided to start filling in right there.
Yeah.
Hey everyone, my name is Dr. Timothy Carl. I'm going to be an incoming Transfusion Medicine and Coagulation faculty member at the University of Chicago.
Okay. My name is Enmei. I am a current faculty member in Transfusion Medicine and Coagulation Pathology at the University of California in Los Angeles. Also going to be the Associate Program Director for Clinical Pathology there. So if you're interested in coming to UCLA for residency.
Hey, stop, I have to get my first.
All right. No messing with the recruits.
Alright guys, I'm Miriam Asif. I'm currently attending at UC Davis in Transfusion Medicine and apheresis, and I'm also Associate Program Director, so I'm going to be recruiting pathology residents.
Very nice. Yeah.
So please come join us.
Program director soon too.
Yeah, give me a few years. We all did our training at the University of Chicago. So Cindy asked us to join her for this impromptu video session to talk about transfusion medicine as a field, talk about what we like about it, and why I think it's a great career option for those of you who are either thinking about going into pathology or who are already in pathology now and are trying to decide on what subspecialty interests you might have.
A lot of people think of transfusion medicine, they think of doing apheresis, right? Mm-hmm. But really, I just want to remind everyone that it actually covers all aspects of blood, from collection to the processing part, to the transfusion part, and then even post-transfusion, because we deal with reactions, right? So in addition to just doing procedures, we also have a lot of oversight of the blood components themselves.
And then in addition to like blood bank proper, you'll often find that a lot of transfusion services also are responsible for coagulation laboratory testing. In a lot of centers, coagulation laboratory testing is usually not its own standalone laboratory. At my institution it is, but in a lot of other places it falls under the purview of either hematology or blood banking, and usually blood banking in my experience.
Yeah, well, at UCLA it's actually the heme coag lab, so it falls in with heme.
Oh, got it. we might have a few babies crashing our video, so no one minds that. So, yeah.
Right. And I feel transfusion medicine is a pathology field where it's the fine bridge between clinical side and pathology. So it is one of the fields that you'll see that fellowships can be done from other fields, like if you're doing internal medicine, if you're doing peds or any other field, you can still do fellowship in transfusion medicine.
That's right.
But pathology brings in that aspect of lab, that we are so precise in the lab aspect of pathology that we learn that throughout the 4 years of our training.
Yes. Yeah, I think that is something that I think is, it may scare a little bit of people away because it is the most highly regulated lab, I would say, in pathology. But that's because there was a lot of harm done a few decades ago before we had testing for Hep B and Hep C and HIV viruses in blood products, and that caused a lot of patient harm.
And I guess going off of what Miriam was saying, transfusion medicine can attract people from many different disciplines, and something that makes it very unlike a lot of other subspecialties in pathology is that there's, as we've discussed, there's a lot of direct patient contact. Whether you're running an apheresis service, whether you're overseeing transfusion therapy, whether you're evaluating transfusion reactions, we are the specialty more so than others. And yes, I know cytology, you will often interact directly with patients, and arguably in autopsy you do too. But anyways, we are probably one of the most forward-facing and most easily and quickly accessible pathologists from the standpoint of the clinical front lines. And that can be appealing or unappealing in equal measure. And I think for a lot of us here, we actually like having close access to patients and to our clinical colleagues. In general, I would say.
Right.
We interface with just about every clinician you could imagine. Whether you're in an academic center and you're interacting with mostly hem-onc colleagues who are often highly trained and have a good savvy understanding of what you do, or whether you're working in more of a community transfusion practice where you're interacting with everybody you can imagine at every community hospital in your geographic area.
Right.
So.
think a lot of things that one of the things that scares people away from transfusion medicine is also the amount of call that people hear about, right? I think a lot of, especially residents who take CP call, understand that a lot of your CP call does come from transfusion medicine. That definitely was the case when I trained.
I do feel like we do take a lot of calls. The call when you take, you're talking to someone who's a clinician, so you're consult of consult. So it can be a neurologist or someone asking for something related to apheresis, and you're their consult because the primary team consulted neurology, and now neurology is asking you, should we do apheresis or not? And it's such a gratifying feeling after that call that you get, that you added something very important right there, that whether this patient needed that procedure or not.
So yeah, this goes back to the thing where I keep saying pathologists are doctors. As pathologists, especially blood bankers, there's a lot of interactions with clinicians and a lot of education. You're teaching other doctors, right?
The field of, or the world of blood bank, especially pre-transfusion testing, there's a lot that goes into it that the average clinician does not learn anywhere during their medical training. I came from, I think, a pretty typical U.S. allopathic medical school training, and I had basically no transfusion medicine exposure. I knew about the ABO blood groups, and that was essentially where my knowledge ends, and that's probably going to be true for a lot of the clinical staff that you interact with, except the savvier ones that I alluded to earlier. It's really satisfying to be able to act as the expert in a patient who has a very complex transfusion need or a complex transfusion history.
I think we take for granted how well we are able to supply blood in a lot of cases. So when people order blood products, they just expect it to be there, right? And that might be easy to do if the patient's never been transfused, they don't have any alloantibodies, they don't have a special blood type that would preclude them from getting general donor blood. But when we have patients that really can't accept 99.9% of the blood out there, those are the situations where I think it's really important to get a transfusion medicine consult.
You guys are saying about like they need specific blood. Can you explain why these antibodies matter?
Sure. So if you think about a red blood cell, and you think about how complex that is, as I guess it's not a cell, it's a corpuscle, but all the same, something that has a plasma membrane, that has all these different sugar and lipid and protein antigens on it, which can have genetic polymorphism across different people in the population. And the fact is our immune systems respond differently to those antigens that are different from ourselves. And so ABO is a classic example of, and certainly it's the most important example of an antigen, a blood group system that can cause compatibility or incompatibility from donor to recipient. But the reality is that there are actually hundreds of other blood groups that don't get talked about commonly and that are sort of purely our domain as transfusionists. I guess we should talk about examples of these. I don't think they need to know that, but when you hear about all these names,
there's more than A, D, O, and RH. There's a ton more. So this is why I'm saying these people are super smart and I'm super dumb.
no, that's not true.
That's not true.
Definitely not a being smart part. Anyways, yeah.
I think another hot topic to talk about is platelets. Like we are in a shortage of platelets because if you think about a donor, they have to sit through 3 hours of a procedure to donate 1 unit of apheresis platelet. And if we're getting platelet from whole blood donation, which not many places are doing anymore, it will take 5 donors to get that 1 platelet unit. But the usage is so high where I always talk to the team that if set a goal, and there are guidelines to set a goal, if your patient is at 10,000 platelet count, why you want to transfuse right now? If he's not bleeding, he's stable, maybe hold on to that. Think about benefit and risk, because every transfusion is like a mini transplant if you think about it in a bigger picture, where you can have potentially antibodies to that at some point developing. You can have a transfusion reaction, you can have volume overload, other things going on, where do you really want to transfuse that platelet and it's coming from a pool where there is platelet shortage that we're dealing with. Yeah.
Actually, that reminds me. This might be a helpful thing to talk about for the audience, which is the many different settings in which you might potentially work as a transfusion medicine physician, because something that's extremely hard to understand until you've actually even gotten to the point of being a fellow and have rotated in different settings. There are a dozen different settings in which you may find yourself in full practice as a transfusion medicine physician. I think the bulk of the audience who are going to be medical students and residents who are going to be in major academic centers, most of your exposure will be in the form of transfusion medicine docs who are on a hospital transfusion service. And that is the capacity that actually all three of us function ourselves.
Right.
We are all academic transfusionists overseeing a hospital. But there are also jobs in the setting of blood donation services. These are like your blood distributors, like the American Red Cross. And there are also jobs that in the world of cell therapies, and actually that includes both stem cell transplants and recombinant cell therapies, where there are niches for transfusion medicine docs.
What would you say for mostly in anatomic pathology? Most of the jobs is actually in private practice or community practice. Would you say something like that is true in blood bank as well, or would you say most of the job is in academic setting?
I would say that I'm not sure if it's a majority, but more than other specialties in pathology, there's a larger proportion of jobs that are academic in origin, and I think a lot of that has to do with the fact that oftentimes complex transfusion therapy and complex transfusion support needs take place in advanced tertiary treatment centers. Those are where you usually find skilled transfusion medicine personnel, and less frequently at like your smaller community hospital.
Right. That's true. But one thing I will add, if you're not geographically limited, if you do transfusion medicine fellowship, you will definitely find a job, because there is a huge job market if you're looking all over US. And if you're geographically limited, then that can get tricky in any field. It's not just transfusion medicine.
So blood bank fellowships don't fill regularly, so there's plenty of fellowships out there for people
There
who are
are open
interested.
fellowships.
Right.
Absolutely.
Are super cute star pathologists?
No, this is, I don't know if she'll be a future pathologist. No guarantees there.
I would definitely add having Zoe, and I also have a kid, and it definitely transfusion medicine, even with the heavy call volume, there is work-life balance to it. With the residency was tough, the fellowship was also tough, but now being in actual like attending position, I do feel like even when I'm on call, I can take calls from home. I don't have to go every time unless it's an emergency procedure, and not every place does apheresis. So if you're at a place where they don't do apheresis, you might not have to go on call to the actual hospital ever. You can take calls from home, filter your work as you go along the day. Like I triage my cases before I even start writing reports, which one needs the report right away, and then there are ones which can wait a day or two, and then if your day looks like it was already too busy, you can just catch up on those reports the next day. So I think that flexibility is really nice.
All right, blood bank is kind of such a rare thing that you don't really get exposed to in medical school, right? And when you start pathology residency, everyone knows about the AP side. Everyone knows about search path. How did you guys find blood bank?
So I went in, as I mentioned before, having no knowledge of transfusion medicine as a discipline, knowing nothing about the didactics therein. I actually only learned about blood banking through my residency training because I had good faculty and resident mentors to learn from. I went to a training program then, and we all did as well, where the transfusion medicine service had a significant service component. And so a lot of residents, we were very hands-on. We took call, we ran apheresis procedures, not literally, I'm not connecting the patient. We ran the orders, we ran the service. I think having that hands-on experience and having to devote a lot of our time and effort to it gives everyone a relatively deep and intuitive understanding, and you figure out really very quickly whether or not this is a field that is a good match for you. Right. And it's not for everybody, and that's totally understandable. Right. But it's important to get those exposures when you're a trainee.
Yeah, that's true. I think for me, having Zen was my chief resident at that time, and he chose transfusion medicine, and I asked him why, and he's like, because it's like the clinical side of it and how and when I started transfusion medicine myself, I felt like it's so intellectually stimulating most of the time, and I loved that. And I'm not in the ER where you have to be on your feet, but you still feel the same rush when you're dealing with the actual patient, actual thing, and it's time sensitive too. So that feeling, it just
that appeals to me too.
Right.
The sort of
Little junkies.
a little bit, but when there is a case that needs addressing, in AP Sure, there are cases that they occasionally have variable degrees of urgency, but when a transfusion medicine issue presents itself, it's something that you focus on entirely until it's completed.
So you live for those Friday night TTP calls.
I don't know what a TTP is, but
Find transfusion medicine found me.
Ooh,
I went
good line.
into pathology thinking I was going to do surge path cyto. I found when I was on that service, I woke up every day and I was excited to go to work. And it was a big decision to make, right? When you go in thinking you're going to do surge path cyto,
Right.
you're like, why do I really want to do this? But I found that like I said, I really enjoyed the material, and in fact, I enjoyed the consult part of it. I enjoy teaching and work with other clinicians. I enjoy working with the fellows, the residents, the medical students, and then this the community, the transfusion medicine community. It's a small community, but I think that's one of the benefits, right? You get to meet a lot of people who, you read their papers and like these are big names and they're at famous institutions, and I can never meet this person, but then you meet them at a conference, and you meet them in person, you work on projects with them, and it's like, wow, I didn't think I would get to work at that level so quickly.
how many transfusion medicine physicians do you guys think actually practice in the United States, like right now, at this moment in time? If we're really talking about graduating classes on the order of 30 to 35, and most people will have 30 to 35 year careers, we're talking about on the order of 1,000 people.
Yeah.
That's across academics, across industry, and across community practice.
Yeah, I don't know the exact number, but 1 to 2,000 sound about right.
Hence why it's a good job market.
Yeah, I guess we are doing this interview now at the very end of 2021, and I'm sure a lot of you have also perceived that around this time there's been a huge opening up of a lot of jobs in pathology. Whether this is the rumored retirement cliff finally actually happening, or if this is some other thing, who knows what's driving it. But there are more job openings open now than as long as I can remember. And the proportion of jobs available for the number of graduates who are entering the field of transfusion medicine right now, it's probably one of the highest, if not the highest.
And pathologists definitely do not retire early. Never.
That's because we love what we do and we can keep doing it. Not because, we have to work.
And, we all need to keep a sharp mind in our old age.
Right.
All right. Any advice for people who are interested in transfusion medicine, things they could do to help them get a fellowship if they need help?
The thing that I would recommend is going back to my earlier point. If you don't have a transfusion medicine rotation at your institution, arrange for an away rotation. Talk to other places. My institution hosts away rotators at other institutions near and far, and we're totally happy to have you guys around. I do recommend finding one that allows you to do as much as you can in terms of getting involved in the running of the service. Experience it all, do it all. It's, you take call, it's hard work. It's not as hard work as Surge Path. Commit yourself to it fully and figure out if it's the right option for you.
Right.
Yeah, I would say you have to find a good mentor.
That's true.
Like these two mentioned, like having someone around who could show you what doing transfusion medicine really looks like, finding someone who's actually in transfusion medicine to tell you what their day-to-day practice is like, that's very valuable. And even just having someone to encourage you along the way, right?
And I would add, if you can, try a conference. Like AABB is huge on having medical students and all, people from all areas. And then you might have a localized, state-wise community.
Like a statewide, yeah,
Right.
exactly. Association of blood bankers.
Association
Yeah.
of blood bank of that state. So try going to those conferences or try joining them and see how their conferences work, what they discuss about. It might just fascinate you right over there. Yeah.
All right. One last shameless plug for University of Chicago. It was a great training program. Yay, nay.
Oh,
It was a
absolutely.
great training program.
It is.
You will not be disappointed by the level of training you received there.
I would definitely add that looking back, I really appreciate those sleepless nights during residency. Like you want to do it there when you're a resident where you can ask questions and nobody will judge you. And you want to take as much work as you can when you're a resident. It trains you when you're attending and you're on your own to make that decision. And I think our program definitely trained us well. Our attendings were really, really good in teaching. where they brought that immense knowledge where you knew that, oh, they would know the answer if you call them.
What are you looking at me for? I'm joining the faculty there. How's that for an endorsement?
Exactly. That's the strongest endorsement you can get.
It also makes any opinion I have about the PFA program
He
worthless.
trained there and decided to stay there, so
Right.
what more can he say?
All right. Thanks you everyone so much.
Thank you so
Alright.
much for having us.
Thank you.
Hi, well, back to me. I hope everyone enjoyed that interview. That was quite a little nice treat they gave us. And if you like this content and you like me and my channel, please like and subscribe. And I will see everyone next time. Bye.